I'm
Hi.
here to discuss today the information people need to know about esophageal cancer and Barrett's esophagus with Dr. Chakrabarty, along with patient Ronald Yates, journalist, author, and public speaker. Dr. Chakrabarty, what is esophageal cancer?
Yeah, esophageal cancer are abnormal cells in the lower part of the esophagus that slowly invade your organs around and eventually take over your body and cause death.
Okay, could you tell us the key risk factors associated with esophageal cancer?
Yeah, esophageal cancer is one of the fastest growing cancers in the U.S. right now. It's a six-fold increase since 1970s. The risk factors for this are several. No one really knows exactly why it's increasing, but we think it's because of the diet in the U.S. and obesity. And this causes people to have more acid reflux. The chronic acid going into the lower esophagus eventually causes the cells to change, and you get a precancer condition called Barrett's esophagus that can lead to esophageal cancer. Other risk factors include age over 50, obesity I talked about, if you have a family history of esophageal cancer. Smoking is a big part of it. If you have an entity called hiatal hernia, that's also puts you at risk. What a hiatal hernia is just a loosened lower esophageal valve where now the stomach contents easily gets into the esophagus, and that needs to be addressed to control the acid reflux.
Thank you. Mr. Yates, can you tell us a little bit about your experience with Barrett's esophagus?
Yes, I was diagnosed with Barrett's esophagus about 8 years ago. At the time, it was not considered, at least I was told it wasn't something I needed to worry too much about. But then over the years, as this began to progress, I began to feel that I needed to do something more. I didn't want to accept this, so I began doing some research myself. And I went onto a website called treatbarretts.com. And on that website, I learned a lot more about Barrett's esophagus, and I also found physicians in my area, Dr. Chakrabarty in particular, who treat this problem. And I went and we underwent, I did an endoscopy and found that I had a more serious form of Barrett's than I originally thought. So in my case, the fact that I've done this and gotten to this point, I've got it under control now, but we've done some procedures which have actually helped solve this problem.
Thank you. Dr. Chakrabarty, what should people do if they're concerned about esophageal cancer?
Yeah, so if you are having heartburn more than 1 to 2 times a week on a regular basis, and you're taking anti-reflux medications for a long period of time, especially over 5 years, you need to go to your doctor and see about getting assessed for Barrett's esophagus, which means maybe going down with a scope, an endoscopy, and then taking a look and see if you have this condition. The only way to diagnose it is by doing an endoscopy and getting biopsies of the tissue there in that area.
Thank you. Mr. Yates, what should people do if they think they are at risk?
Well, the first thing you want to do is not ignore it, because if you have this condition, it can lead to esophageal cancer, and the survival rate for that form of cancer is only about 17%. So you don't want to ignore this. You want to get to your doctor. The endoscopy procedure is very simple. It takes about 20 or 30 minutes at the most. It's barely invasive at all, and you come out of it with the knowledge that you're going to need to have in order to treat this condition.
Thank you. Dr. Chakrabarty, just what is esophagus dysplasia?
Yeah, so esophageal dysplasia is a pre-cancer condition, and there's different degrees. So dysplasia is just a way of describing abnormal cells in the lower part, in the esophagus, but we call it overall Barrett's esophagus. Now, Barrett's esophagus have different degrees of dysplasia. So there's no dysplasia, which puts you at risk for esophageal cancer at 2.9% over 10 years. But there's intermediate, and then there's high-grade dysplasia. High-grade dysplasia is right before it becomes esophageal cancer, and Ronald had high-grade dysplasia. That puts you at risk for esophageal cancer up to 10% per year, which is a lot higher. So 10 years ago, people would just go in and get their esophagus cut out, and you can imagine now part of your stomach is up in your chest, and it makes it very difficult to eat. It's a very morbid surgery. But now we have this new treatment where we can go down and actually burn the tissue down called radiofrequency ablation. burn the cells down to the stem cell layer, and then this regenerates new tissue that's normal and healthy, and basically prevents you from getting esophageal cancer.
Thank you. Mr. Yates, you recently shared your story about being diagnosed with Barrett's esophagus, and due to dissatisfaction, with standard passive treatment, you decided to take a more active role in your treatment. Can you tell us a few ways a person can take an active role in the treatment plan regardless of the disease?
Well, I think the first thing you need to do is make sure that you have had the endoscopy and that you are familiar with exactly what's going on within your esophagus. And then I myself had a hiatal hernia, so after I had undergone the 3 radiofrequency ablation procedures that Dr. Chakrabarty explained, I had my hiatal hernia repaired. And as a result of that, I have not had any symptoms at all of acid reflux since last June. I'm not taking any kind of medication. I've not taken any kind of heartburn medication at all since I had this done. So in my case, that's how I've dealt with it, and I think I feel pretty good about it now.
Thank you. Dr. Chakrabarty, is there anything you'd like people to know about esophageal cancer?
Yeah, esophageal cancer is obviously very dangerous because it's one of the fastest growing cancers. You can only imagine now, this tumor is growing in your lower esophagus and food's getting stuck, or you're vomiting blood, you're losing weight. You can't enjoy your food anymore you're eating. We take that on a daily basis for granted. So you need to get assessed if you're having chronic reflux signs. Now, there's numerous kinds of reflux signs that people need to be aware of. I mean, the classic thing we hear about is heartburn, which is like burning in the lower chest. And that's the classic symptom everyone knows from fatty foods, spicy foods. But you can have atypical heartburn too, or reflux. And that's where people may feel like food is coming up into their chest, or they have severe chest pain. They think they're having a heart attack, and they go get assessed, and they find it's not their heart, but it could be actually acid reflux. Or they have laryngitis, or a chronic cough, or even asthma. That's because the acid is coming up so high into the esophagus that's going down your airway and irritating your lungs. Those are the signs that you need to be aware of. And for having those symptoms, you may need to be assessed for reflux and get it under control. It could be silent. You may not know you have it.
Okay, I'd like to thank you both for taking this time and discussing this with me. Thank you so much, and have a great day.
Thanks,
Thank
Debbie.
you.